Oh.
Okay, so maybe just start off by just telling us where you're traveling from.
Sure. I'm from Blaine, Minnesota.
Okay, so not super far from here.
No.
Just on the north side of the cities. And what brings you in?
I have been kickboxing and strength training, and something happened to the right lower hip and back.
Okay, and that was back in roughly April?
Yes.
Okay, and it's been kind of that way since, right?
Yeah, for almost 6 months.
And what are some of the things that you've done to help kind of mitigate the symptoms or pain?
So I've been going to a chiropractor weekly just to kind of get my lower back pain checked and adjusted, and then some stretches.
Okay, and the adjustments do seem to help. It just not maybe sustained for as long as you'd like. And how did you learn about our office and this procedure?
Actually through TikTok.
Okay.
I've been looking at the ring dinger procedure for a long time, and then just happened to Google if Minnesota had one.
Gotcha. And we worked in the algorithm, so that's awesome. I'm glad to have you here for sure. I'm glad you found us. Prior to getting in the room here, we did a thorough workup and we took good medical history, and you spent a little time on the roller table, right?
Yes.
How did that feel?
Relaxing, and I could definitely feel the pressure in my lower back.
Some aggravation as those rollers came through. Okay. So in the exam, there were some positive orthos in the right low back. The L5 dermatome was a little bit compromised, not too bad. Strength was pretty good for the most part. Leg length, I would say was pretty equal, but her hip extension was a little limited. And so I'm hoping that with this procedure, we'll see some positive change in all of those things. So you ready to do this?
I think so.
All right, let's do it. You said earlier your husband kind of sent you
Yes.
to test this one out.
He's been apparently eyeing this procedure for a long, long time. And usually sends me in.
It just took your problem to test it out, but I'm going to have you set these off. That's right.
Yeah.
Yeah, you're going to feel the legs go up. And then I'm going to have you slide that way just a little bit. That's good there. You'll notice the towel is damp, obviously. We do that for leverage, and it just helps kind of prevent friction. Okay, these pins are going to go just above that bone right there. In here. Borrow your hands. Okay, I want you to grip my hands. Keep your arms loose. Keep your arms loose. Good. Feeling snug in there?
Yes.
I want you to just maintain a nice breathing pattern in through the nose, out through the mouth. Good. Good, and just kind of maintain that. Big breath in. All the way up. Good, you'll feel a little tension.
Oh.
That one's pretty dynamic, right?
Yeah. Wow.
That felt really good. Where did you feel it? Anywhere in particular?
Right up into here.
Okay.
And definitely my neck.
Okay. That's a good start. For sure. She's kicking. That's good, right? Take this off. Good, I'm having you spin around. And go ahead and stand up. Make sure your legs still work. All right. Any unusual like pains, pinches, spasms at all? Just take a few steps. You can kind of go back and forth.
No. I really felt it in here.
Yeah, felt quite a bit in there. You've never moved that way before.
Yeah.
Your body could be like, what just transpired there? So what we're gonna do, I'm gonna get you into the other room. Okay. We'll finish up this first session, and then we'll have you take a break, get hydrated, do a little bit of walking, and then we'll reassess the need to do a second one.
Okay.
Okay. So highlight it, right?
Yeah.
A little easier than last time.
Yeah.
Okay. Just kind of grip my hands here. Good. All right. Again, just kind of work that breathing pattern in through the nose, out through the mouth. Feels okay around the neck there? Good. Good. Good, and you'll feel a little bit of tension here.
Oh.
Good. All right. Feel all right?
Yeah.
That's nice, huh? A little bit different than the first one?
Yeah, definitely.
Yep. How did that one differ? Feel it anywhere different? Or just maybe more fluid?
Yeah, more fluid.
Okay.
Yeah.
Yeah.
I'm surprised there's crunchies left.
Right? All right, so that's your first ring dinger experience. What are your early impressions?
Oh, it's shocking and also great. Like,
Yeah.
I felt like I could walk much smoother.
Yeah, because we had you go out and walk for a few, probably a half hour or so.
Yes.
Yeah.
Mm-hmm.
And you did you manage to go down the hill and back up?
Yep. I went all the way to the park and around it.
Yeah.
So, and it just felt much more fluid.
Yeah.
And not as stiff.
Good.
So.
Good. Well, I'm glad that you were able to experience that.
Mm-hmm.
This one is like way different than anything else that's out there, right?
Absolutely.
Oh, yeah.